I came downtown on Skid Row about 16 years ago because I had unresolved issues. There were deep unresolved issues. So I came out with everybody else that was trying to get rid of their problems and did what they did. Just smoked away my hurt, pain, all that. Until it got to the place, it stopped working.
I experienced bad divorce. I gave him the keys for the house. I tried to pay my rent, but it was so hard to pay for it. I had to go sleep in the street.
I was 59 when I first experienced homelessness. In my late years of adulthood, I lost my apartment, and I was taking care of my father until he passed away.
Anytime we talk about homelessness, we need to think about the root causes, where at its heart, homelessness is a lack of resources problem. It's a poverty problem. And when we think of women experiencing homelessness, we also need to think about the cumulative impact of gender disparity in wages and earnings throughout the lifetime.
Before I get a residence, I just come here, sleeping over there, because it's a safe place. I sleep in here, I put my thing in here. I was losing hope. About time I was almost losing my hope. Come the help. A very nice lady. She told me, "Do you know where is Downtown Women's Center? You don't know anything about it?" And next day I came. Here looked like a little palace. I've been in Downtown Women's Center about 6 years. They gave me everything.
Downtown Women's Center, in my view, is a center of excellence in services for women, health services and other services for women experiencing homelessness, and services that also facilitate women's movement out of homelessness into permanent supportive housing that is safe and stable, and indeed permanent. The SCALE initiative is a very important project that's situated within a larger initiative sponsored by the Robert Wood Johnson Foundation, 100 Million Healthier Lives campaign. SCALE stands for Spreading Community Accelerators through Learning and Evaluation.
We noticed this application from the Robert Wood Johnson Foundation and thought, that looks like what we do and what we could use more help in growing. And so we reached out to strong partners like the University of Southern California, and we went for it.
Our experience with SCALE has really shown us that the collaborative effort and research components to designing programs can be extremely helpful in trying to understand the needs and barriers clients face when they are trying to address their health issues. So we know that there's chronic disease programming that really helps people manage their chronic disease. However, when you bring it into our context, we've recognized through the SCALE initiative, sometimes there's some breakdown, because if a woman doesn't have a place to store fresh fruit and vegetables, how is she going to eat healthy? So as a collaborative and as a community, we're working together to try and find ways to make higher level systems change that will help address some of those barriers.
We have to remember that the women, the persons who are experiencing the needs, are also the experts in terms of the services they need. And so to have the voices of the women, the representation of women as equal peers around a table was absolutely invaluable. How else would we begin to design a program that's effective and that is based on a strong foundation other than to involve those who the program would serve? In this case, the women with lived experiences.
SCALE teaches you how to communicate with your provider, how to shop for healthy foods, how to use your money wisely.
I have asthma, high blood pressure, depression. Wellness Women program is about get healthier and helps me a lot. I've been taking my own experience walking by myself a mile.
I'm managing diabetes. I don't have to be sick with it. I'm managing it, and I'm having a better life.
Scale is really big on people-reported outcome measures, so people being able to tell you, this is how this program has changed my life, this is how this program has impacted my health.
The outcomes of Scale were remarkable in that they really demonstrated that we could move the needle through community-based participatory action. We could move the needle in terms of chronic disease management, where women are active partners in their own care.
We can't do this work without partners like University of Southern California and many community-based organizations that have come to the table to help us address inequalities, even in the Skid Row community. These partners are helping us raise the voice of women who are experiencing homelessness and establishing strong health programs together.
I just do the best I can each day. That's what Scale taught you. If you try each day to do something, little improvement, gets better each day.